Thank you. The Honourable Leader of the ND Opposition.
Thank you, Mr. Speaker. Doctors at the U of A hospital are reporting the most severe patient backlog since 2010. The emergency room is so full, doctors are treating patients in the corner of the waiting room. Experts say the backlog is a risk to patient health and safety and requires urgent and immediate attention. So to the Minister of Health, what specifically is your government going to do today to alleviate the unacceptable status of the U of A ER?
The Honourable Minister of Health.
Thank you, Mr. Speaker. We have great confidence in our emergency doctors. They do an incredible job. The nurses and their teams do tremendous work. We realize there are challenges with an ever-growing population, but we have done some things in order to do that. We're reducing the dependence on acute care beds, opening up new long-term care beds. We've moved, actually, of the original 464 people, we've moved almost a third of those people into long-term care beds. We've put in transition beds, making every effort at this point in time to try to help the system. We understand there's an issue, and we'll continue to work with the physicians and the emergency doctors.
Thank you. For supplemental.
Well, it doesn't seem to be working, Mr. Speaker. U of A doctors say fewer than 40% of patients are being seen and discharged within acceptable timelines, and instead patients are waiting up to 8 hours to see a doctor. This crisis in ER occurs repeatedly, and every time this government puts a Band-Aid on the problem, they then rip it off through their own incompetence. So to the Minister of Health, when will this government take off its ideological blinders, start providing an actual increase in the number of long-term care spaces for patients trapped in our hospitals, and fix this ER backlog?
The Honourable Minister.
Mr. Speaker, several months ago we started that process, and under the leadership of the Seniors Minister, we're continuing that process. We're building more and more beds, long-term care beds, supportive beds, trying to move people into those facilities. It doesn't happen overnight. As I said a few seconds ago, we have moved almost one-third of our original goal, 460, within the first year into those beds. We'll continue to do that. All of our team is working very, very hard to be successful, and we understand the challenges.
Final supplemental.
Well, thank you, Mr. Speaker. Well, speaking of long-term care, when it comes to long-term care, this government is sitting by while Covenant Health saves money and reduces patient care hours on the backs of both patients and loyal, long-serving frontline workers. So to the Minister of Health, Covenant's so-called reorganization is awe-inspiring in the level of chaos it is creating right now, and it will undoubtedly contribute to the number of vulnerable and ill patients who end up in ERs unnecessarily. So to the Minister, why in heaven's name are you letting them get away with this?
The Honourable Minister.
Mr. Speaker, Covenant Health is an incredibly well-respected organization that runs several facilities in Edmonton, and we are a great supporter of theirs. Fact of the matter is, they're a private operator, and they decided to make some changes. They have to meet all the standards set out by the province of Alberta. We will ensure they do that. They made a modest reduction of about, I think it's about 5 staff in their 3 facilities. We have 650 employees. They'll continue to deliver service. That is a group of people, Covenant Health, that's passionate about people, will continue to deliver what's needed to Albertans.